Minister, thanks for your time. We appreciate you being available. A couple of quick ones. Firstly, do you have any evidence that the cluster in the Sydney pub was linked to Victoria?
We don't have specific evidence ourselves. This is being developed by the New South Wales health authorities. We have had some initial reports that that's a prime source. It's probably the most likely source, but they are doing what's called the contact tracing, so going back to the original source, and that's their working theory at this point in time. It's not surprising.
Okay, and the other one is on aged care in Melbourne. What is your advice at the moment for Melbourne? Should every resident who tests positive be removed from the facility?
We're making that capacity available, and the response is a clinical response. So in other words, the doctors and the medical advisors on the ground are determining whether or not somebody can be isolated, whether they need to be separated and removed, or taken directly to hospital. And all of those options are on the table. We've made sure, in conjunction with the Victorian authorities, that there is immediate capacity. This remains always the most serious of cases if there's an infection in an aged care facility.
Would you like to, particular, on the evidence, would you like to see it happen? With every case, to make it uniform?
One thing that I've always done is never put myself in the shoes of the doctor. It's to make sure that the doctors have all of the available material, and they have the immediate capacity to take everyone to hospital if they believe that that's in the best interests of the patient, to separate, to isolate, or to move. And that's what we've done as federal authorities, to make sure there's immediate testing of all staff and all residents, and the capacity to provide whatever is the appropriate hospital care.
Minister, has Victoria told you what the tipping point might be for another phase of lockdown, stricter and a tougher lockdown?
Look, at this stage, they are working through their options. They haven't ruled anything out. Right now, our goal, everyone's goal, is to help flatten that curve within Victoria. We've done it once. We know we can do it again, but it does mean everybody doing the really difficult things. Staying at home, keeping that distance. If you can reach out and touch somebody other than your household members, that's too close. The cough etiquette,
can I just take
masks where you can't social distance.
Sorry to interrupt you. I've just got a bit to get through. Can I take you to the numbers, though, yesterday? Horrible numbers yesterday after a bit of a reprieve the day before, relatively speaking. If we get numbers like we did yesterday from Victoria, do you think we're very close to another stage of lockdown?
I'll be cautious on that. Okay. Our focus is to make sure that we do get the numbers down. Victoria is assessing every day, and in particular through what's called the medical expert panel, but also through their own work. Our role is to increase the resources. We're bringing in, after our offer to Victoria, an additional 1,000 ADF, and that will also include some senior leadership to assist with the tasking inside the contact tracing program.
To be ready for it.
Advocating for this, and that's been accepted.
Okay. Just a quote from New South Wales Premier last night, speaking to Michael Rowland on 7:30. We have to learn to manage these outbreaks. My question to you, given we're still experimenting in Australia on the best approach to COVID-19, what's holding you back from trying for elimination? On the evidence that we've had, on the failures that we've seen, learning from that, and then pushing ahead for elimination?
Well, actually, we're simply being honest about the fact that in a global pandemic, which is now past more than 13 million, our goal is always to get to as close to zero cases as possible. But with the example of the hotel quarantine in Victoria, after Victoria had zero cases on one particular day, that came from the hotel quarantine, not from the community. It's obviously had a catastrophic impact in human terms as well as in societal terms, and that was after zero cases from outside of the system, and that's an example of why we want to be honest. We don't want people to relax. We want to be absolutely clear that this disease can strike. It could come in ways that are unseen, and so
but I guess,
we're
Minister,
aiming to have as close to zero as possible.
I understand that. I guess I'm saying that hotel quarantine, that debacle has happened, and that we've learned from that. and that these locked borders, I mean, if you've got New South Wales going one way, Victoria another way, the borders might have to stay closed. One state goes in and out. So we're really in a
Can I ask Paul,
paralysis
what
for a
are
long
you
time.
actually... Can I respectfully ask, Paul, what are you actually advocating? Do we stop people coming from overseas? Do we stop all trade with overseas?
Yeah.
Do we stop humanitarian arrivals?
No, I'm not. I'm not advocating for it. I'm just sort of exploring this,
well,
because a lot of people are asking.
All of those things are the elements that you would require if you are going to have total, absolute, hermetically sealed Australia with no elimination. So just, again, ask if that's what you're proposing.
Yeah, no, I'll be clear with you. I'm not proposing it. I'm asking because a lot of people are thinking, well, is that something that we should be now thinking about? Just one last one.
Look, our goal remains as close to zero as possible, but as we've just seen in a genuinely sort of well-intentioned way, if somebody were arguing for that, that would mean obviously, clearly, no gatherings, no protests, no trade, no returnees from overseas, no family reunions, none of those human contacts. And in a world with over 13 million cases, and clearly it's going to head towards 20 million at some stage, and with over 575,000 lives lost, we need to be honest that this is a global pandemic. Nobody's immune. Therefore, we have to prepare. The vigilance that we have will have to remain with us. And the reason I'm saying this is because if we try to pretend it away, then there will be outcomes which are real and significant and human. By being vigilant, by being upfront, I think we have the best means of possibly protecting ourselves and remembering Australia has overwhelmingly done extraordinarily well, and Australians have been magnificent. So can we do this?
Yep.
Yes. Do we have to do it again in Victoria? Yes. But we'll get there.
Just one final one on the contact tracing app. Much has been said about the failures. What's being done right now to improve our contact tracing beyond the
what
app?
failures, Paul?
Well, it hasn't picked up.
What failures?
It hasn't been able to trace any positives. It hasn't been useful in that regard.
Well, that's incorrect. There are over 200 cases that have been identified.
Okay, so you're happy with the way that the contact tracing's been done in the country?
Oh, no, there are two different things here. Our number one federal concern in Victoria is contact tracing.
Yep.
We are working with Victorians. We're encouraging them to reach the standard of every case, every day, every case, every day. That has to be the standard for tracing and then for following up the contacts. We're bringing in additional federal resources. We will have very senior military leadership, which has now been invited in by Victoria at our suggestion to help with the tasking within the contact tracing unit in Victoria. We're bringing people from around the country. Public health officials from other states are remotely tracing. And so we've been offering, providing, suggesting, proposing those resources. We're thankful that Victoria has agreed to accept them, and they are doing everything they can, but we're supporting them in that task, which is our number one federal concern, along with the aged care.
Greg Hunt, we appreciate you making yourself available.
Thanks, Paul.